Hi there, I'm Kerry Lyons and I am a dementia specialist Admiral Nurse. In this video, I'll be talking about NHS continuing healthcare. NHS continuing healthcare, also referred to as CHC, is care that is arranged and funded by the NHS for individuals who have long-term complex health needs, or what's described as a primary health need. You have a primary health need if dealing with health issues is the most important aspect of your care. Care packages can be provided in a variety of settings outside hospital, such as in someone's home or in a care home. And these packages are available in England, Northern Ireland and Wales. In Scotland, NHS continuing healthcare has been replaced by something called hospital-based complex clinical care. This only covers care in hospital settings, but local councils and health boards have been working together over the last few years to develop services that support this for those with high-level needs at home or in a care home. You can find out more at careinfoscotland.scot. If you're eligible for NHS continuing healthcare, any care and support that you need will be paid for by the NHS. This is the case if you live at home or in residential care. So who is eligible? NHS continuing healthcare is available to anyone over the age of 18 who has a long-term health condition that severely affects their health needs. If you have a diagnosis of dementia, you may be eligible for NHS continuing healthcare. But a diagnosis alone does not automatically mean that you will receive it. You will still need to be assessed by the local NHS body, such as your local CCG or clinical commissioning group. A team of health professionals will look closely at your health needs, how complex they are, and how they affect different aspects of your life, like eating and drinking, continence, and your emotional and psychological state of mind. I'm going to talk you through the process of applying for NHS continuing healthcare and the stages involved. So what is the process for applying? There is usually a two-step process, an initial screening followed by a full assessment of eligibility. Let's go through this now. The first step is the completion of the eligibility checklist, which is carried out by a health professional. They will carry out a brief assessment of your needs to see if it would be appropriate to move on to the next stage, where you will go through a more detailed eligibility assessment. Going through this initial checklist is a conversation that could happen face-to-face or over the phone. That's down to your local continuing healthcare team and the way they conduct assessments. Whichever way the conversation takes place, we strongly advise a friend, advocate, or health professional sits with you while the assessment is completed. If you progress to step 2, you will be referred for a full eligibility assessment, which involves a more detailed look at your health needs and is carried out by an NHS continuing healthcare trusted assessor, who will be considering your health needs in the context of the broader NHS continuing healthcare framework that they work to, against which they check your eligibility. They may ask for more details such as care plans and want to speak with other professionals involved in your care to build up a full picture of your needs. We strongly advise that at this stage, you seek the support of a dementia specialist who understands the application process. This could be an Admiral Nurse or a health professional who works directly with people affected by dementia. You can contact the Dementia UK Admiral Nurses on the helpline at 0800 888 6678, or you can visit dementiauk.org/closer to home to book a phone or video appointment with an Admiral Nurse and talk to them about your application. There are different aspects of care which are covered in the assessment. And we recommend that you go into the assessment having thought about these different areas and how severe and frequent your needs are. They include mobility, For example, is there a risk of physical harm from falls, psychological and emotional needs, and someone's ability to communicate? This is just a summary of the sort of things that the assessor will be looking at during this part of the process. There are many different scenarios and circumstances that are considered at this stage. We've developed a supporting leaflet to this video, which includes a comprehensive list of these areas. Our advice is to describe your needs on an average bad day. It's very easy to underestimate these needs, especially if you've been dealing with them for a long time. You may have lost sight of how ever-present they are. We recommend being honest and realistic about your needs, all the needs of the person who you support. That's why it can be helpful to discuss them beforehand with somebody close to you, and why having a dementia specialist by your side throughout the assessment could be vital in ensuring that your application is successful. Within 28 days of completing the assessment, the NHS should decide if you are eligible for continuing healthcare. A panel of health professionals will make a decision based on the information that has been given throughout the process. There are 3 possible outcomes to the process. You will receive either full funding, which comes entirely from the NHS. Joint funding, whereby both the NHS and the local authority pay for the funded care package, or no funding. If you are approved for joint funding, you will be allocated a social worker who will oversee the social care funded element of your package. If the decision made is that you are eligible for NHS continuing healthcare, your care package will normally be reviewed within 3 months and then continually reviewed over time at regular intervals, usually annually. This means that if your care needs change over time, the review will consider whether you are still eligible and whether the level of care you receive will change too, so it's appropriate for your needs. Receiving NHS continuing healthcare as a personal health budget. You can choose to receive your care package as a personal health budget or as payments that go directly to the necessary care services. If you decide to receive your funding as a personal budget, you will have more direct control over your funding. A personal health budget means that a designated person can manage the budget and decide where it's spent. This designated person could be a health professional, a social worker, care organisation, or a family member. This option can provide you with more flexibility, which can be helpful as a person's needs change over time. For example, if a person's needs worsen and they need to move from one level of care to another, this can happen straight away with a personal health budget. Without a personal health budget, switching the funding to go to a new care provider could take some time to process. If the decision is that you do not qualify for NHS continuing healthcare at this time, it is possible to appeal the decision. But if you go down this route, you should make sure that you do so with the support of an experienced healthcare professional. For example, if there was a mistake in the process on the first application and this is corrected in your appeal, you may be successful. Otherwise, we advise that it is best to start the process again, especially if your needs have changed since the first application, with a health professional supporting you, advocating for you, and guiding you through the process. There is a fast-track process for NHS continuing healthcare. If your health is deteriorating quickly and you're nearing the end of your life, you should be considered for the NHS continuing healthcare fast-track pathway so that an appropriate care and support package can be put in place as soon as possible, usually within 48 hours. The process for applying for NHS continuing healthcare can be extremely challenging and frustrating, but it is important not to be discouraged by its complexity. That's why we advise you have a dementia specialist at your side supporting you along the way. We understand the emotional impact of looking after someone with dementia and the additional stress that comes from going through an application for continuing healthcare. Looking after someone with dementia can be a 24-hour-a-day job, and one that can be both physically and mentally demanding. It's important to prioritise your own needs and recognise that you are not just a family member, you are also a carer. There is a huge range of resources on the Dementia UK website in the Support Us section that are geared towards supporting family members and carers. Dementia UK is working hard to raise awareness of NHS continuing healthcare amongst families and improving the support and advocacy for families through the process, through specialist support and clear information. You can find out more about our continuing healthcare campaign by visiting our website. If you need further support on the NHS continuing healthcare process, you can download our accompanying leaflet, where you will find a glossary of all the terminology, or call the Admiral Nurse Dementia Helpline on 0800 888 6678, 0800 888 6678, 7 days a week, or visit dementiauk.org/closer to home to book a phone or video appointment with an Admiral Nurse. That's all from me, and I really hope that you have found this video useful.